Sounds good. Thank you, Dwayne. Good afternoon, everybody. This is the Health Board meeting for the City of Yankton for Monday, February 22nd. And again, just to reintroduce to folks watching live on YouTube, the members of the Health Board are voting members, Mayor Nathan Johnson, Dr. Mary Milroy, myself, City Manager Amy Leone, and then we have ex officios, a number of ex officios, Brad Beast from Community Development, Dave Mingo from Community Development, our City Attorney Ross Denherter, and Commander Jason Foote from the Police Department. Katie Huff, who is a registered palliative care nurse with a Very Sacred Heart, is also serves as an ex officio, and she sometimes is able to join us. So if you see that name crop up, that's who that is. Not a lot of new business today, Health Board members, but we did talk about last week about those metrics that we visited about, that we would revisit those weekly when they were updated. So I don't anticipate a long discussion today unless somebody thinks we need one. I've shared my screen with the updated numbers. If you're taking a look at the metrics, we have done a little bit better on our case numbers, and then we dipped or stepped a little bit back further on our hospitalizations for the week. However, we're still 3 or less under that hospitalization, so we are still within that goal achieved. Now, whether or not the commission will decide to use these criteria or not will be up to them, but good for us to have access to and to know. We also learned today from our emergency management meeting that the 65 plus age group and also some other categories of folks that may have comorbidity are eligible now to register for vaccines. So we should start seeing what I call the Cheerio metric change and have a little more, look more like a Fruit Loop than Cheerio, we hope. So any comments people want to make, or would this change anybody on the health board's position or recommendation to the city commission?
This would not change my position, but I think it again enforces the need to kind of reaffirm the resolution in that it's way too early to let our guard down. We definitely need to continue to follow safety precautions, that masking, distancing, hygiene, avoiding crowds are still essential, and to as soon as you're eligible to participate in the vaccine program, which does look like it's going extremely well, that's encouraging. But I think the fact that 2 of our metrics are not met and the third one's kind of teetering on the line is telling us that we just can't let our guard down. But I am still in favor of presenting the resolution and our support of that to the City Commission.
I think Dr. Milroy stated it very well. That's where I am at too.
Great. So just for the public's benefit, if they didn't hear our meeting last time, the health board recommended.
I think the metrics are helpful. Those are some.
We're in your dead zone.
Shit.
And I can't get out.
Dr. Milroy, we can't quite hear you. I hope you're not the one driving. I don't think you are.
Oh, I'm sorry. Okay.
Okay, well, we're waiting for Dr. Milroy's.
No, we're traveling in the car, and there's some. Hello, can you hear me now?
We can hear you now, Dr. Milroy.
Oh, okay, I'm sorry. We are in the car, and there seems to be some spotty cell service. I apologize for that. But I think we're at a better spot right now. So
Okay.
I might,
You
we
are
might
coming
just
in-
pull
you
over
are-
and wait.
Okay, you are coming in clear now. If you want to restate your comment, we didn't quite get the last comment.
Oh, I was just saying that thank you to the staff and to you, Amy, for putting together the metrics. I think those are a good, concrete set of parameters for us to follow weekly. So that was just a thanks to those of you who put those together.
Okay, thank you. Yes, I'll just restate for the public's benefit that if they didn't watch our meeting last week, the health board met and recommended that we make the recommendation to the city commission that given these metrics are where they are and where we are in the community in terms of compliance, that we that they allow for that resolution to their mask ordinance to expire on March the 1st. However, we keep in place the resolution that is currently effective, and that we take their direction on anything further. So we'll continue to meet on Mondays with these metrics updated so that we can stay current if something should really change north or south on any of these metrics. I'll go to the ex officios to see if there's anything they would like to state or add or comments about the metrics this week. Mr. Bees, do you have anything to add?
I don't.
Mr. Mingo?
I don't really have anything of substance to add. I think we're in the same place we were last week when we talked about this.
Thank you. Mr. Denherter?
I would agree. My position hasn't changed since last week.
Easy group today, Mr. Commander Foot.
Yeah, no, nothing new for me either. They look good to me.
Okay. Yes, and I feel that way as well. I don't think there is any motion to make then. I know we had said we won't consider any further resolutions or any further action for the commission till we find out what direction they take this evening. So we do have a city commission meeting at 7 o'clock. It will be streamed live on our YouTube channel so folks can watch that. It's the second hearing, public hearing of the mask ordinance. So there's time for public comment if people want to make that. They'll be limited to 3 minutes of comment, but everyone's welcome to do that, or you can comment using the chat. So we'll also take those comments as well. Other than that, any other business to come before the health board? Okay, then we'll let Dr. Milroy go where she's going, and I'll look for a motion to adjourn.
I'll second.
Okay, all in favor signify by saying aye.
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 Aye. Opposed, same sign. Thank you very much. We'll meet at the same time next Monday, and we'll see what happens this evening as to what's on our agenda for that date. Thanks, everyone.
Okay. Thank you.
Thanks, everyone.